All right, everyone, let's get into it. So normally I get dozens of questions about what physical therapy actually is. Who's it good for? Can it treat this diagnosis? What happens during a physical therapy session? So I figured I'd make a video to address the 10 most common questions I get about physical therapy. Hi, it's Dr. Nick, your friendly functional physical therapist, looking to clear up some misconceptions and help you determine if physical therapy is in your future. Let's jump into it. Question number 1. How do I know if I need physical therapy? Well, if you have pain, stiffness, weakness, you're having difficulty doing the things that you used to enjoy doing, getting out of bed, getting out of a chair, climbing stairs, you just had a surgery. I mean, honestly, those are the main reasons we would see someone. But if I had it my way, I'd be doing prehab on people. My patients know this. You're going to learn this too. I'm a pretty cheesy individual, so I like to use analogies. I like to abuse analogies. One of the things I like to say is dysfunction is a snowball tumbling down a mountain. You generally don't see it start to develop at the top of the mountain. You only see it when it's a gigantic snowball about to hit the village at the bottom of the mountain. If I had it my way, I'd be seeing you sooner to the development of the problem. That way, it's not this gigantic catastrophic thing that we have to deal with. Yeah, it's a long-winded answer. I'm a long-winded person. Oh well, I'm not gonna edit that. One take, baby. Question number 2, what actually happens during a physical therapy session? That is a fantastic question, because a lot of people for some reason like to think that it's a fancy massage and then you do clamshells and go home. For the love of God, if that's what's happening during your physical therapy sessions, find a new physical therapist. Now, realistically, what you're doing during a session is going to depend largely on what you're coming in with and the therapist that you're seeing. So I can't speak towards everyone. I know personally what I like to do in the setting that I'm currently at. I'm dealing with a lot of chronic pain patients. So people who have been moving dysfunctionally for a long time just because of coping strategies. So I like to generally start my sessions out walking backwards outside for 5 to 10 minutes. Then we're coming inside, we're doing some light dynamic warm-up stretches just to prime muscles and reduce that risk of injury. And then if I feel I need to do any soft tissue work, I'll do some light soft tissue work sparingly, and then we're going to progress directly into engaging the appropriate musculature, right? Fixing the actual underlying issue that caused the dysfunction in the first place. Because at the end of the day, if your issue is facilitated by weakness, if we don't strengthen that weakness, nothing will ever get better. So that's what I like to do, and I think I've seen a lot of success with that. Question number 3, is physical therapy just for athletes or major injuries? Absolutely not. Like I said, I would love to see patients before there's an actual issue. At the first signs of an actual problem, if you injured yourself lifting or you felt a twinge doing something, if you just kind of sweep it under the rug, that's where these issues become big snowballs. I mean, going back to my snowball analogy, that's where these become real major problems. When we just sweep it under the rug and be like, I'm gonna get better on my own. Unless you're in your, teens or early 20s, you don't have that kind of healing capacity anymore. So go see a physical therapist and take care of that issue, because it's gonna balloon out of control if you don't. Question number 4, can physical therapy help with my headaches or migraines? Actually, yeah, it can. The unique thing about the headaches or migraines is where they are tells us what the cause is to a degree. If you feel it around your eye or your side of your face, going down your neck, if you feel it in your forehead, top of the scalp, back of the head, these are all just pieces to the puzzle. And if we're dealing with a tension headache, we help reduce that tension. We strengthen the musculature antagonist to those tight muscles to improve kind of the postural health, and bingo bango, no more tension on that nerve, no more headaches. It's pretty fascinating. You get someone and they're complaining of a headache, and you do a little movement that takes 30 seconds and then bam, it's gone. It's pretty fun experience. But yes, it can. Question number 5. Do I really have to do my physical therapy exercises at home? Yes. I mean, no, but like if you want to get better, you will do them. Like, and this is one of the reasons why I tell patients, unfortunately, physical therapy doesn't work for everyone, because as a therapist, all I can do is show you what to do. It's on you to take that and run with it. It's very easy to say, oh, I'm just going to go get the injection. I'm going to take the Tylenol. I'm going to have the surgery. But that's just digging a hole. That is no way to get better. Again, I'm not in the field of hiding the issue. I want to help you recover, right? So if we determine that these are the exercises that you need to do, these are the movements that you need to do to correct the underlying issue, it's up to you. You got to do them. Sorry. Question number 6. How long does physical therapy take? Well, unfortunately, that's largely going to depend on what you got going in and your genetics, unfortunately. So some things could be resolved in a visit or 2, depending on what they are. Other things are more severe. They might take a couple months, a few months. Other things are even a lot more severe. That's poor English. And take even longer than that. So unfortunately, this is again one of our favorite answers from school. Thank you, professors. It depends. The most important thing to understand, though, is you're going to get out what you put in. So if you are lackadaisical, that's the word of the day, about your exercises, if you are frequently late to your therapy sessions, biggest pet peeve of mine, if you are canceling visits, if you're not taking it seriously, I mean, you're not going to get better. Those are the facts, unfortunately. So yeah, it depends, but put in the work and you will see the results. Question number 7. Can PT help with my sciatica? A damn sciatica. What a pain in the butt. This is so stupid. Yeah, 100%. I mean, I hate the term sciatica because it's so generic. Sciatic nerve pain can be the product of a number of things going on. But yes, depending on what's going on, pending any like crazy things happening, physical therapy 100% can help with your sciatica. Again, it's going to be dependent on you performing the things that we tell you to do. But yeah, either we have to take pressure off that nerve root, we have to take pressure off that peripheral nerve, we have to strengthen weak muscles that are allowing excessive movement in one direction, causing compression on that nerve, or we have to help strengthen spine stabilizers to improve kind of the foraminal space that the nerve root exits out of to decrease that spinal loading occurring there. So it's a long-winded way of saying, yes, we can help with sciatica. Question number 8. Is it normal to feel sore after physical therapy? Yeah. I mean, a lot of what I do is exercise. I mean, getting musculature to relax and then exercising other muscles, which are likely very weak and haven't been doing their job properly for a while. So that soreness is gonna be a real thing. But as you progress through therapy, it won't be as severe. It won't last as long because you're gonna be getting better. So while the soreness can happen initially, it's something that's gonna get better. Just keep up with stuff. Question number 9. Can physical therapy help improve my balance and prevent falls? Yeah, 100%. Again, if you're having unsteady feet, if you're having difficulty walking, if you're falling before, if you're of the older age where falling is a bit more of a concern, physical therapy can help you retain or regain that lost balance in, appropriate strengthening of musculature, in, appropriate center of mass over center of gravity exercises with some dynamic, challenging movements. It's about putting your body in these environments safely under the guidance of a physical therapist, and then getting it stronger, enabled to do those things. So 100%, falling is a big risk, and that risk increases as we age. One of the things they used to say is a fractured hip above the age of 65 is kind of like a death sentence. And unfortunately, I don't want to say it's true, but like, it's a concern. So make sure that you're exercising on that balance, right? We're trying to improve that stuff so you don't fall. And lastly, number 10, do I need a doctor's referral for physical therapy? I love this answer. It depends. Really where you live, what your insurance is, all that type of fun stuff, because some states allow for things like direct access, where you can just go in and see a physical therapist without a doctor's referral. And you're allowed to do, I believe, 14 visits before a referral is actually required. So 100% a doctor's referral isn't 100%. A doctor's referral isn't always. So no, a doctor's referral isn't always necessary, but it is going to be dependent on the state that you live in and the insurance that you have. So if you're able to, go see a physical therapist, circumvent the whole referral process if you can, just because that is a big pain in the ass. But yeah, just check for the rules in your area. All right, so that's some of the most frequent PT questions I get answered. If there are any I missed that you have, drop them in the comments down below and I'll get to them as soon as I can. If you found this video helpful, hit that like button down below and subscribe for more PT related content and more information on how to move better and pain-free. As always, this is Dr. Nick, your friendly functional physical therapist, saying stay active, stay healthy, and hopefully I don't have to see you.